Welcome to the Perspectives on Healthcare podcast, where members of the medical community from different roles, venues, and locations share their unique perspectives on quality healthcare, its future, and how to improve it. Now, from the Your Keynote Speaker studio in Pittsburgh, Pennsylvania, here is your host, Rob Oliver.
Thank you and welcome. My guest today is Doriana Parkin. She is from Toronto, Ontario, Canada, our friends to the Great White North, and she is a member of Generation X. She is a former family physician, and we will talk a little bit about what she is doing now, but I'll start with this. Doriana, welcome to the podcast.
Hi. Thanks, Rob. Thank you for having me.
Absolutely. So tell me a little bit about yourself and your role in healthcare, please.
Sure. So I am a family physician in Toronto, just north of Toronto, actually. And so I practiced as a family physician for 15 years. And about 2 years ago, I decided to close my clinical practice. I still maintain my MD, but I decided to close my clinical practice, and I wanted to sort of branch off into a different role in healthcare. I started my own business, my own company called Simply Fit Wellness. And really the goal was to help women who are, professional women, busy women, who have kind of lost themselves. They've lost their sense of self. They've lost their, control over their diet, their food. They've lost, their relationship with exercise and physical activity. And so I developed a program to help these women sort of get back on track and, really focus on the preventive aspect of their health and healthcare. And so I developed a program to help women with that. And it's basically a coaching program. So that's what I'm doing now. And I guess the reason is because I had a primarily young-ish practice. So most of my patients were, like women between the ages of 30 and 60. I also had a lot of young families. But so, 15 years of, seeing women struggle with yo-yo dieting, the impact of diet culture, the lack of, paying attention to their own needs and their own care because they're giving to so many other people. That was really what spurred me to develop the business and the program. Also, I've always sort of had a love for everything sort of fitness and nutrition. And I think a lot of that comes from my own experience with diet culture growing up. So that's what I do now full time. And, I'm still sort of always thinking about what I can do, to keep my hands in the medical field. But this is sort of like my separate little endeavor, my little baby, I call it, this business of mine that I'm trying to foster and grow.
Sure. So what I'm hearing you say is in your practice, you were serving a broad population, but you were seeing a specific need within the women's population between, and you mentioned the ages like 30 to 60, where there's a particular issue going on there, and you're able to take now and form a business that addresses that. Am I kind of understanding the progress of how things worked for you?
Yes, absolutely. I mean, I guess the only thing I sort of didn't mention or left out is just, why I decided to make that sort of leap and change. Sure. And essentially it came down to physician burnout, specifically family medicine in Toronto, in Ontario, in Canada, is under a lot of stress right now. Our healthcare system is struggling with many, many different things. And it just got to the point where I wasn't, I guess, not feeling fulfilled, because I loved what I did in terms of helping others and serving others, but it wasn't meeting my needs. And so this was my way of being able to still help other people, other women specifically, and really target the niche that I felt drawn to, and do it sort of on my own terms.
Got it. What I'm hearing kind of in the subtext of what you're saying is that the passion that you felt that drew you into the profession of being a family physician in the first place somehow became disconnected because of the way that you were forced to practice, or the system within which you were working. Is that kind of an accurate description?
Yeah, I would say that's pretty accurate.
Okay. So what does quality healthcare mean to you?
Oh, well, quality healthcare, number one for me, is access. So people having access to, everything in life, I feel like, is a balance. So it's access to good healthcare without the abuse of healthcare, especially because here we have free healthcare. And so balancing that out, right? Having patients see us when they need to see us, but also educating patients, in terms of when do you need to see your doctor? When do you need to go to emergency versus your family doctor? When should you be seeking out help? And, what does that access look like? So that's, one really important, part of it for me. The other part, just in terms of general healthcare, is prevention, and so we focus a lot in family medicine on treatment, diagnosis of disease. And a lot of that is because of the time constraints that family doctors are under. We're so time strapped. So that was part of the struggle for me, was I found that I did a lot of my counseling around treating, conditions where there were steps that, can be taken or could have been taken to possibly prevent or manage, these conditions, but just lack of time. We can't be educating and treating and diagnosing all, in a matter of 1 to 2 visits. So I felt to me, good healthcare is just as much about the prevention as it is about the treatment. And that's something that, just because of the way the healthcare system works right now, we don't have the luxury of, really addressing both of those issues in totality.
Okay. I want to go back to something that you said. You mentioned abuse of the healthcare system. It's a thought that I hadn't had before. Can you talk a little bit more about that?
So when I say abuse of, and that might be a little bit of a harsh word, but I think there seems to be, because we're so lucky here in Canada that we have access to healthcare, and we don't have to sort of pay for it out of pocket. I think it's not even so much intentional abuse. I think a lot of the times it's just people using the system because they don't understand how the system works. So, for example, going to the emergency department because, you've had an earache for the last, 3 hours. Going to the emergency department to have a pregnancy test done, things like that. And when you're in the system, and you're working as a physician in that system, that's when you really see how bogged down the system gets because of things that can be managed outside of, emergency. I'm just using the emergency room as an example. There are others, but, and so that bogs the system down. And, based on the healthcare models that are used in primary care, it trickles down and affects, I can only speak to family doctors because I'm a family doctor, but that whole system, the way the system works, it all trickles down into the family doctor's office and how we work, and then what we're left to sort of deal with and pick up the pieces. So, I mean, I'm sure that there are people that use the system knowing that there's a better option. I think those people are very few and far between. And I think a lot of that has to do with our responsibility in healthcare and in the government to educate patients. This is how the healthcare system works. This is why, you don't go to the emergency department for A, B, and C. This is when you would call your primary care physician, for example. And that education, I think, is lacking.
Sure. And let me just say, from a personal perspective, this is one of the reasons why I value telehealth so much. And that is it gives me information about where I should go with this. So I'm able to get a consult with a nurse or, a physician's assistant, and we're able to have a conversation to say, this is what I'm experiencing. Is it something that I need to go to the emergency department with? Is it something I need to make an appointment and can see the physician at the end of the week? Or is it, to go to an urgent care center? I don't know if you've got the urgent care centers up there in Canada, but it's it's not an emergency room, but it's kind of a
Right.
on-demand doctor where you can go see someone fairly quickly, and so having the telehealth consult really helps to determine where should I go with the issues that I'm facing right now.
Right.
Does that make sense to you?
Yeah, yeah, and we also have telehealth. It's called telehealth, and we have walk-in clinics like what you're referring to. And again, it's very. I think it's far more intricate. The whole system is far more intricate and complex than the general public knows, and so those are the types of services that could potentially, if the system worked well, those services could really take some of the pressure off of our acute care frontline workers. And but again, it really requires a lot of communication
Sure.
between people, between departments, between organizations, and so it's a system that can work well, if it's sort of structured properly.
Okay. Can you give me an example of quality healthcare?
Quality healthcare, like for the average patient.
Sure. Just
Yeah, I think quality healthcare would be, for example, if I had a patient, so they're able to see me when they need to see me, there would be some system in place where, almost like a triage system, right? Like, do I need to see you? Like you said, do I need to see you today? Can this wait a week? And that would definitely be helpful in terms of keeping primary care physicians triaged properly, having access to that physician in a timely manner, having the system work so that your primary care physician can do preventive counseling as well as disease, diagnosis and treatment. But the preventive counseling and the education would be part of that healthcare. And then basically having things, in medicine, a lot of stuff is just about time, right? Having things done in a timely fashion and having good communication between specialists, specialist to specialist, having good communication between your primary care physician with your specialist, and also having resources. So as a family physician, some of my patients, I was trying to help them, but I was limited because of lack of resources. And so if you don't have those resources in place, it doesn't matter how quickly a patient can get to me. It's how quickly can I get that patient to the appropriate resource, whether it's a psychiatrist or a general surgeon or a pediatrician. So I would say those are the big ticket items. I'm sure that there's obviously many, many more.
Sure.
But in order for a patient to go from point A to point Z, those are the steps that have to be taken and have to work well and efficiently.
Yep. Excellent. Okay. And just translating for all of my American listeners, point Z is somewhere very close to point Z.
Yes.
Yeah. Doriana, what do you wish people understood about your role in healthcare?
Well, there's a lot. Again, because one of the main reasons I left medicine was because of burnout. So the question was, sorry, say it again, Rob. What do I wish people
What do you wish
knew about
people
healthcare?
understood about your role in healthcare? And you can look at that either as the family physician role or your current role in coaching, either way.
Okay. I think one of the things there's a couple of things, and this is kind of like a melting of the two now careers that I've kind of gone through. One of the things that I wish people sort of knew was that, doctors are not magicians, because a lot of times, people are coming to us because they want something fixed. And a lot of times, whether it's a chronic illness or something that we just haven't diagnosed yet, there isn't always a solution. So the physician's role is not only or always about treating and curing. It's about helping patients cope and manage. And that's as important as, obviously as diagnosing and treating conditions that can be treated and can be cured. But a lot of, to me, your family healthcare provider is also your advocate, your teacher. And sometimes it's a journey. It's not just, it's not a one point interaction. The other part that I think really came out quite strongly with COVID, but also now that I'm in the wellness space, and most of my stuff is done online, it's that there is a slew of information that's available on the internet, online. And one of the things I think that is really key to healthcare from a wellness point of view is weeding out information that's false versus information that's not, that's true. And that can be really hard, especially when you're looking at, Instagram pages and content that looks like it's coming from somebody credible.
Right.
So I think it's really important for people to be able to think critically, but also to understand who the experts are and ask those experts before, partaking in any kind of treatment or journey or program.
Yeah. So it's interesting. I speak about quality healthcare and to medical associations and medical professionals, and it's the reminder of why patients come to the doctor. The patients come to the doctor because they're experiencing a limitation or they're experiencing an issue that's keeping them from doing what they usually do, and they want to get back to doing that. But the other thing is that people are coming and they are dealing with a new life circumstance that the doctor may not be able to cure or fix, but may be able to help them have, as you said, the resources to live a full life and get back to doing as much of what they were as possible, given the current circumstances of their life and that diagnosis. So very interesting.
Yeah.
What excites you about the future of healthcare?
Well, I think that it's hard. It's kind of a loaded question because right now I feel like our healthcare system here is suffering. So there's most of the time I'm sort of feeling like a little bit concerned, actually, more than excited about healthcare. Sure. But I think from a general sense, look, I mean, I think that we living in Canada or living in the US, we have like some of the best technology, some of the best researchers and scientists who work tirelessly to obtain new data, new science, new information, new treatments. And that's always exciting, and it's one of the things that, people say, well, sometimes doctors can be difficult to trust because one day you're saying one thing and then the next day you're saying something else. But that is evolution of medicine, right? That's the epitome of evolution of science and medicine and, treatments. And that's how things get discovered and, tweaked and perfected. So that always excites me because I see a lot of that happening. I see a lot of these people, clinicians, scientists, researchers doing really amazing things. I mean, my husband just had, he's 46, he just had a heart valve replacement. He was born with a congenitally defective valve, and he had something called the Ross procedure by Dr. Tyrone David, who is world renowned. And these are things that, this procedure, basically, they took his aortic valve out, they replaced it with his own pulmonary valve, and then they gave him a donor pulmonary valve. I mean, that is amazing.
Right. Wow.
Right. So, yeah. So stuff like that, you can't not be excited about that. And I think the other thing is, so that's like my coming from a medical part, coming from the wellness side. Mm-hmm. What excites me is that although there is a lot of misinformation out there, I think we're getting into a time now where there's also a lot of people like me who are becoming aware of this and really fighting hard to put out the proper information. And because of that, I think that we're starting to sort of really, tackle diet culture. We're starting to really help. I'm kind of speaking on behalf of women because that's really my clientele for the most part. But we're really starting to get into the basic fundamentals of preventive care. Your preventive care is about, yes, there's certain things you can't control, like your genetics, but it really is also about your nutrition and your exercise and your environment, your community, your relationships, all of that. And I think people are becoming more and more aware of that, which is exciting because that gives people hope again, right? They're not stuck.
Sure.
They're not in a situation that is not changeable if they are able to seek out help from the right people.
Got it. Yeah. And sadly, I will tell you this. I have spoken to patients from around the world, and nobody feels as though their health system has it exactly correct. So everybody sees the faults and cracks in their own system. And it's sad to say that none of them are spot on, and none of them can serve as the exact model to say, hey, if everybody just did it like this country did it, then we would all be in better shape. And this is the model to go with. All right, last question for you, and we are very short on time, is what is one thing medical professionals can start doing today to improve the quality of healthcare?
I think one of the things that medical professionals can do is communicate with each other, and we need to advocate for ourselves. And I mean the professionals as a profession, because we know what it's like to work in the career of medicine, and you can only make a change to a system that's going to improve the lives of your patients if we have if we are able to give that information to the people making changes. So whatever the system changes are, that's going to directly improve the lives of patients. And so I think we need to become more active in, advocating for ourselves and, telling the people in the positions that make these changes what we need.
Yeah, and I would say that not only if the physicians and the professionals are advocating for systems change, those systems changes are not just going to affect the patient experience, it's also going to affect the provider experience, and it will make the system something that works better for everybody. Listen, Doriana, thank you so much for being with me today. I appreciate you taking the time. I appreciate you sharing your thoughts, and I respect your perspective on healthcare.
Thanks for listening to Perspectives on Healthcare. Visit perspectivesonhealthcare.com to learn more about Rob Oliver or to subscribe so you never miss an episode. If this podcast was valuable, we'd appreciate a review on iTunes. Or if you tell a friend or coworker about the show, that would be helpful too. Join us again next time for more Perspectives on Healthcare.